Here we are going to talk about all the aspects of psychology. First, we'll see what is psychology all about and how we develop from historical perspectives and researches. Perception, sensation, human consciousness, human development, basically all these things leading us to talk about the human thoughts. Here we can see some videos and researches. We have a lot to talk about over these things. Why don't we just go ahead, get it started. Psychology. Psychology is the scientific study of behavior and mental process. Behavior can be directly observed. You just can watch somebody and take some notes about someone. But it's not easy to observe the mental processes. You can't just look at somebody and say what they are thinking about or what they are going to do. But not until recently. I think past few decades have developed some really cool imaging devices like fMRI or PET. These devices allow you to quite literally see what's going on with the brain when a person is thinking about something. Okay, before we getting into these stuff, let's just start with the most basic things. So the word psychology literally means the study of the mind. So psyche means mind or soul, whatever, and the logos means study. So the psychology is the study of the mind. If you are watching this video, you're probably wondering what the psychologists actually do and what kind of different careers that you could go into in psychology. First, we'll go through the timeline of psychology and we'll see who helped us to develop theories and researches and where we are in the psychology world at the moment.
The science of psychology has 4 goals, and you'll want to not only know what they are, but you'll also want to be able to tell the difference between them and identify examples of them given to you on questions. So the 4 goals are description, explanation, prediction, and control. I'll walk you through each one of these 4 goals, and then I'll give you an example that demonstrates all 4 of those goals in use. I'll end by telling you how to avoid some of the more common mistakes that people make with this learning outcome. So let's start with the first goal. The first goal is description. This is when you are simply observing behaviors or situations and you're recording what you see, what you hear, all the information that you're gathering. That sounds pretty simple and it sounds pretty easy, but you have to remember to not include any bias, any opinions when you're describing. You literally just want to record exactly what you are experiencing. So the first goal is description. If you're standing on the side of the street and you're taking notes about cars and behaviors that you see, how many cars stop at a stoplight or how many cars run through a stoplight, that would be an example of description. The second goal is explanation. This is when psychologists try to understand why something is happening. So they're looking for some theory. And again, a theory is just a general set of explanations or observations about some idea, trying to explain why something is happening. If you have road rage, like I do a little bit, not a lot, but a little bit, I tend to get angry when people cut me off in traffic, when people drive slowly in the left-hand lane. A psychologist using this goal would try to figure out why I have this aggression behind the wheel of a car. Where does that come from? So that would be an example of explanation. The third goal is prediction. And this is when you try to figure out what will happen in the future. Sometimes we'll take tests like the SAT, and these tests are designed with the goal of prediction in mind. The idea is we can look at how well you perform on this test, and that will allow us to predict how well you'll do in college. SAT and all those tests aren't always perfect predictors, but that's at least their goal. So that would be an example of prediction. The fourth and final goal is control. This is when psychologists are actually trying to change something in the environment. Usually they're trying to decrease an illness or increase positive emotions in people. There are psychologists currently using control to try to eliminate Alzheimer's disease, which unfortunately probably affects several of you in some way. Control in a road rage example might be if someone had trainings or interventions that they want to give people to make them less aggressive behind the wheel of a car. So those are the 4 goals: description, explanation, prediction, and control. And again, not just enough to memorize them, but you'll want to know the difference between them. The easy way to do that is to think about the questions at the heart of each goal. Description asks, what is happening now? Explanation asks, why is this happening? Prediction asks, what will happen in the future? And control asks, how can this be changed? So if you think about those 4 goals in the context of the questions behind them, it actually gets much easier to tell them apart.
Okay, what psychologists do? Well, there are many different kind of careers that you could go into in psychology. If you are interested in mental health field, there are 4 basic roles you can take. You can be the psychiatrist, who's trained to be a medical doctor initially, and they get additional training to treat people with various mental health disorders. Oftentimes it involves the prescription and some kind of medications like drugs. Then clinical psychologists. So the clinical psychologists typically have a PhD or PsyD, and they got training and psychological theory, even the research methods, and they can apply them to the people with various mental health disorders. Then you have counseling specialists. They typically have master's degree, and these individuals tend to specifically work with the people on certain kind of issues. So imagine family therapy or school counseling. And finally, psychiatric social workers. That requires special kind of degree. Their whole direction is to apply social science principles to helping people in the hospitals or clinics. These are the important and popular roles in psychological science today, but there are some more popular topics too. Biology. Studying how the biological processes and the activity inside the brain related to the human thought. Development. So how is the brain change and grow along with the body? Learning processes. So how do you human and animals learn and remember those things they have learned? And there are a lot of researches on personality as well. So what's make people unique and individual? And a lot of researches that involves animal. So I'm sure that you must have heard about rat studies or studies using dogs. The whole point of doing these research is to know about animals and to make a conclusion which involves human. General based differences or ethnic differences, cultural differences, just trying to see how these different groups of people behave or think or different in interesting ways. Now we'll talk about classical conditioning. This is Dave. When Dave was little, Dave went to the dentist to get filling. And the filling caused Dave a lot of pain. Poor Dave. In this situation, the dentist is the unconditioned stimulus because she caused the pain. The pain Dave felt is unconditioned response. Now when Dave is an adult, he goes for a routine dental checkup. But still Dave feels a lot of stress. In this situation, the routine dental checkup is a conditioned stimulus, and the stress Dave feels is a conditioned response. Operant conditioning. So this is Susie, and this is Susie's teacher. Now when Susie does well in school, her teacher gets her treat, or the teacher takes away a bad grade. In this situation, the treat that Susie gets is a positive reinforcement because Susie gets something what she wants, and the bad grade is taken away is a negative reinforcement because Susie loses something which she doesn't want. Now the Susie bad in school and teacher makes her to stay after the school, or the teacher takes up her phone. And in this situation, the time the Susie stays after school is a positive punishment because she gains something which she doesn't want, and the taking her phone up is a negative punishment because she loses something which she does want. I hope you learned about conditioning. We'll move to the next topic. Top-down and bottom-up processing. When you're talking about perception, top-down and bottom-up processing is a topic continuously debated by psychologists for a long time.
How are sensation and perception related to cognition? Is perception constructed by cognition apt to direct cognition?
These are the questions that lead us to these different approaches. We'll start with bottom-up process. Bottom-up processing is data-driven and it states perception directs cognition, that is, we started at the bottom with observable patterns and this informs higher order cognitive processes. To simplify this a little bit with an example, sensation involves your eyes collecting visual information and your ears collecting auditory information, and so the other senses. If you imagine a mosquito buzzing around your head, your eyes collect visual data of the surrounding environment and your ears hear the buzzing. And once these states reach the brain, this process perception has occurred. The cognitive component then takes over, and the intention to swap the bug is formed and transmitted into the action. So the bottom-up process, outside data, is used by the brain. Cognitive processes to do the things like make decision and determine behavior. Top-down processing. Have you guys ever woken up in the middle of the night and shuffled to the refrigerator or to the bathroom in the dark? Sure, all of us have. This is where the concept of top-down processing enters the picture. This approach states that our behavior is influenced by the conceptual data with higher order cognitive process that construct our experiences and the expectations. So to put more simply with an example, you are wandering around your apartment in the dark. You are able to get around fairly well because you conceptualized what your apartment looks like. That is top-down processing, because your perception and behavior was driven by what you expected to see, not only by the visual data alone. So the bottom-up processing states that perception directs cognition or behavior, and top-down processing states that perception is constructed by cognition. Gestalt psychology. Psychology is becoming an extremely large field of study with many different theories and branches. Now I'm going to focus on Gestalt psychology. The belief that individuals perceive objects and patterns as a whole unit rather than individual parts. The whole is greater than the sum of its parts. Originated in Germany at the end of 19th century and took off in 1912. This is Max. With the flashing train lights led to his interest in the concept of perception. He has studied at the University of Frankfurt in Germany. Here's Kurt and Wolfgang. They are Max's assistants in the same university. Together they have created and researched the School of Gestalt Psychology. To prove that they were correct, they came up with the experiment called Phi Phenomena. The lights were flashing in order on and off, but we see a circular movement. Was also created with the laws of perceptual organization: similarity, pregnance, proximity, continuity, and closure. The laws of similarity says the things that are similar tend to be grouped together, like the image here, rows of white and black circles. The law of pregnance states reality is reduced in the simplest form of possible. The example here, 3 circles and 2 large triangles overlapping, but it's 2 different dimensional drawing. Technically none of the shapes are really present. Now the law of proximity. Our brain tends to group together the objects that are close. A good example of this Adidas logo. And the law of continuity is simple. We follow the smoothest path when we are on the line, especially where the smiley faces are. Finally, the law of closure. This is how we view the incomplete objects are complete. Here's a simple X-shaped example along with the more complex one. The concept of Gestalt psychology are increasingly common in advertising, especially company logos. For an example, the arrow and FedEx or Mitsubishi's diamond formula triangle, there are thousands of examples. Gestalt psychology is an extremely useful branch of psychology, and its influence can be seen all around us in everyday life.
So my name is Sarah. I originally studied psychology because it was something that I was incredibly interested about. I love learning about people in all the different ways
I studied my undergraduate in psychology at Liverpool University in England, and then I did a master's at Edinburgh University in child and adolescent mental health and psychological practice. I just finished that in September. I've done quite a bit of work experience. I worked as a healthcare assistant in a private hospital for adults with general psychiatric problems and addiction, and adolescents with eating disorders. I was also an assistant therapist there. And last year I worked with the NHS, the health service in England, as a research assistant. As a healthcare assistant, you work on the wards. It was an inpatient unit, working with nurses, doctors, psychologists and therapists. So you have to be quite willing to do some teamwork. Helping patients, making sure they all followed their health plans for the week, taking them to therapy sessions, doing observations. Each patient was on different interval observations, some 15 minutes, some half an hour, some an hour. Just have to check on the patient, make sure they're following their plan and check their mood, taking blood pressure and their weight and things, just helping out the nurses. As activities coordinator or assistant therapist, I used to run 2 groups a week, taking patients to groups. Sort of acted as an occupational therapist, but I'm not qualified. So took patients for coffee, took them shopping, took them to the gym, took them swimming, just anything to try and decrease their anxiety levels and get them off the hospital ground.